is also here. He won't be giving a statement, but he's happy to answer questions if you want to talk to him after. So with that, I'll ask the minister to give his statement.
All right beside you. Sorry, I was sneaking up right behind you. Well, thank you very much, everyone, for coming, and thank you to the Honourable Laurie Hahn, retired Lieutenant Colonel, for joining us as well as MLA Brad Rutherford. I want to talk about the decision of the Trudeau government to cut the rates they pay for healthcare services provided to members of the Canadian Armed Forces. You may not know it, but the Department of National Defence pays separately for care for members of the forces. It's outside of the Canada Health Act, the same as WCB, for example. As a separate payer, DND sets the rates it pays to Alberta Health Services and to other healthcare providers across the country. Historically, they've paid rates determined by the provinces to cover the costs. But recently, the provinces were informed by DND that they had unilaterally changed the rates. They changed the rates and informed us after the fact. The new rates are a fraction of our costs. For an outpatient surgery, for example, our cost is about $1,400, and the new DND rate is $200. The result is that AHS will lose about $2 million per year on the services that it provides to our forces members. Now, it's not a huge amount compared to the overall cost of health care, but I'm dismayed by the way that the decision was made. We weren't consulted. We had no input. In fact, I understand from our department that DND has refused to share the rationale for the new rates. The decision is disrespectful towards the provinces, and it's hypocritical given Justin Trudeau's recent commitments to expand Medicare. The reality is that this is a unilateral cut in healthcare funding from Trudeau's government to the provinces. But most of all, it's disrespectful towards the forces. They should never have to hear about an issue like this or wonder if their care is going to be paid for. So I want to say a couple of things. First, I want to say to forces personnel in Alberta, our government honors your service. This decision will make no difference to your access to care in Alberta. And second, I want to say to Justin Trudeau, do the right thing and reverse this decision, this cut in funding for health care for forces personnel. I'll be sending a letter to that effect to the Minister of National Defence later today. I'll also support my department in reaching out to our counterparts in other provinces to coordinate a joint response to DND. And tomorrow as well, we will be putting forward a motion regarding this issue, which we hope we will receive bipartisan support. Thank you very much. And now I'd like to offer the opportunity to MLA Brad Rutherford to offer a few words.
Thank you, Minister. I am very honored to serve as the military liaison for the government, and I'd like to echo the Minister's comments and reinforce my own personal experience in discussions with my counterparts in other provinces, and also highlight that with so many members of the Canadian Armed Forces waiting to or having been recently deployed overseas, that we don't need this added stress put on them and their families. This just isn't right. It's not the way our federation is supposed to work, and it's not how we expect a Prime Minister to manage his responsibilities for the care of the men and women in our Canadian Armed Forces. So I'm proud of the Minister and our government for calling on Justin Trudeau to do the right thing. Thank you.
Thank you, everyone. Any questions? So first of all, this is regarding the care that AHS provides to our forces personnel. The military has their own primary care network, as it were, so they'll still receive their primary care services through that avenue still. This is about AHS, the same way that AHS would provide services to someone who's from outside the province. Typically, they send an invoice to a separate payer, like DND. So this is a matter of AHS sending the invoice, letting DND know what the services were that we provided to those service members, and DND we're being told now by them not paying what the full costs are for that amount.
Why do you charge more to DND?
No, that's a falsehood. We don't charge. No, we charge cost recovery. That's a mis.
Why are the costs different then?
Well, the cost is no different. It's the same as this is a separate payer, like workers' compensation, paying for forces personnel for the services that AHS provides. It's also important to remember that our forces personnel don't get to choose where they live. So they're told where to live within our country, and if they come to Alberta and they get the care, so this is mostly going to be acute care that's provided by AHS, or scheduled surgeries that are provided by our specialists, and AHS sending the invoice to DND for that cost recovery, and DND now telling us they're not going to pay the full amount.
Minister, you see this as perhaps an argument for having a few more private options in healthcare in Alberta?
I don't see that being a related issue, I have to admit. I mean, this is about us being able to continue to provide services for our members, and the disrespect to the provinces and the disrespect to our forces personnel.
So what can the province actually do from here on out? Like sort of a little bit more long term. If this isn't changed at all federally, what can Alberta do?
Well, we're going to continue to provide. This is the most important thing for anybody listening to me. The most important thing is for our forces personnel here in Alberta to know that their care is not going to change. And the next steps are going to be for us to be able to work with our counterparts in other provinces to have a joint response. And hopefully, when Justin Trudeau hears our response to this decision, that he changes and reverses these cuts to our provinces.
How and when did you find out?
So I have to admit that yesterday, before when one media outlet had questions for us, I briefly got briefed yesterday about this issue. Was asked a couple questions about this yesterday. Asked them, answered them for Global, and but this was yesterday. It came to my attention.
Does Alberta set the fees for what military members are sort of looking at when it comes to their healthcare service?
No, as I said, these are rates that are determined by DND unilaterally. So,
But some provinces do get their fees, some provinces do set their fees provincially, right?
we advise them what our cost recovery is. And now this is unilaterally DND making the decision that they're not going to pay the full amount.
Has it been an issue for some individuals that they were asked to know some
No. So the question is about whether forces personnel were asked by us or DND. No. No.
Can you talk about the bill that you're putting forward tomorrow?
A motion. So we're still drafting the context of it, but it's going to be calling on all elected officials within the legislature to call on Justin Trudeau's government to reverse these cuts to our provinces.
Does it go further than that? Is it going to have like your ministry looking into things and what it can do?
I'm imagining. I mean, we're still drafting the motion, and so it's going to be tomorrow. That's why we're not going to have it in time for today. But this is going to be calling on actions to be taken by the federal government, Justin Trudeau's government.
Come October 21st could be an Andrew Scheer government. At what point do you see this changing?
And this will not change. Whoever is going to be the government on or after October 21st, we are going to be calling on to reverse these decisions.
Sure.
When did you find out about this, and what was your initial reaction?
Basically the same time as the minister, through, I think it was Global. But, I was a member for 10 years. I was parliamentary secretary for a number of years to the Minister of National Defence. This never came up. I worked closely with the Premier when he was the Minister of National Defence. This was never on anybody's radar at all, so this is a surprise.
How much is it going to impact vets? Many of them do come back and need maybe some extra care or gone through things that they do need healthcare for.
Well, we're going to rely on the province of Alberta to take up the slack, which the minister said they're going to do because that is the right thing to do. And hopefully the federal government will reverse this and put things back the way they were.
How can the province pick up slack? Like what mechanism? Since the Canada Health Act, I'd say it's a separate system. It's a separate billing system. The province can't bill for these services. How does the province?
Well, the province is going to do the right thing, and I would hope that other provinces will do the right thing. As the minister said, we don't get to pick where we live. That's chosen for us. So we rely on the same standard of care across the country, no matter where it is. How that's done, if it's done differently from province to province, frankly, that's not our concern. Our concern is getting the care that we need.
What's the emotional reaction to this? Is it a bit of a slap in the face or
Well, yes. It's just one more, one more pick at the scab, if you will. That do they really care about the military? Do they really care about the military members? And you have to start questioning that. I mean, I've had questions for a long time. I'm partisan, so let's not beat around the bush. Somebody's trying to save money. How much money? I don't know. You'd have to ask them.
Do you think that the looming election sort of played
Well, you know, they tend to do things quietly and under the table and count on the media to pick it up. Unfortunately, the media did pick this up and brought it to people's attention, and the minister and the provincial government are doing the right thing. I,
Thank you. Thank you.
that's another issue.
Thank you. Thank you.
Okay.
Are you going to be taking other steps, Mr. Hahn? Are you being out here today publicly? Or?
Well, you know, if the minister or the premier want me to play a role, I'm prepared to do that. I mean, I'm not important enough to have any influence in that, but I am a retired member, and I do know a lot of members, obviously, and it's an issue that is important. As Brad said, you know, we've got folks in Latvia and more people deploying, and they deploy all over the world, and they don't want to be, the families, to be worrying about, you know, what's going to happen if something happens to a husband or wife. Pretty simple. Thank you.
Thank you, everyone.
Thanks all. Sounds like we're done, folks. If you need anything else, we're all around, but for now, we're going to head back inside. Thanks very much.
It's a pleasure to meet you. Let me know how the
I will.
goes.
Thank you very much. Appreciate it.
Thanks, guys.